Each year, approximately 30,000 cases of Lyme disease are reported to the CDC by state health departments in District of Columbia. However, this number does not reflect every case of Lyme disease that is diagnosed in the United States every year. 96% of all cases are reported from 14 states, Maryland and Pennsylvania being among them. More problematic is the fact that the symptoms are improperly diagnosed up to 50% of the time, and the average patient suffers more than 2 years before Lyme disease is confirmed. Brittany, why are we getting this so wrong?
There's lots of different reasons as to why the medical community and then the public are getting this wrong. To start with, it's the testing. There's two different two-tiered tests that we use. It's the Lyme test and the Western blot test. In order for Lyme disease to show up on any kind of testing, it has to be in the human body 4 to 6 weeks prior to being tested. And most people, if they have the bullseye, they'll go to a doctor's office right away.
Right.
And the doctors will order the ELISA test, which is too sensitive and won't showcase a positive. It'll often showcase false negatives. Okay. And that's why you have 50% of chronic Lyme patients that have false negative test. The CDC recommends that doctors test first with the ELISA test and then follow it up with the Western blot test, which tends to be more accurate, but it still is only testing positive 17% to 66% of the time. So that's part of it. The other issue is that, as you said earlier, Lyme disease encompasses possibly over 300 different symptoms. It tends to mimic other illnesses, anywhere between multiple sclerosis, fibromyalgia.
Yeah.
So often people will be diagnosed with other diseases first before Lyme disease is even considered.
Wow.
Yeah, a friend of mine, his daughter, has gone through some of the testing because they weren't sure because of the symptoms. And apparently, I mean, there's a good many people that don't even show up in those statistics.
Exactly.
Because they don't know. I had somebody I worked with some years ago in Washington, D.C. Her boyfriend had Lyme disease, but only found out after a long time. This was about 1990, 1980, something like that. And it wasn't diagnosed, so he was already into the long-term part, which is much harder to deal with, you know, and it's still happening now. And when I was looking through some of this, I noticed the amount of funding that the Centers for Disease Control does for this
$23 million.
is nothing. And you know darn well, unless somebody pushes, and this President, Congress, and everything, you're not going to get a single extra dime.
No.
Well,
to deal with this. Really, it's growing. It's on the West Coast now.
It's the fastest growing epidemic.
Yes.
So they say it's worldwide. The only country it's not in is Antarctica.
And
probably because of the bacteria probably can't live.
Well, the other thing that, and I forget what you call them, but the little tiny baby ticks. They can be
the nymphs.
Yeah, the nymphs. They can be the size of a pencil point.
Yes. Or a needle point too.
You can't see them.
You can't see them.
And they can inflict this disease just as easy as their adult counterparts.
And we dealt with this at home. My better half, she had a bullseye on her right here on her side arm.
Yeah.
Then immediately she had it for a week, and she went to the doctor. And what they gave her was just antibiotics.
Yeah.
It happened to me in the Marine Corps. When I had symptoms, they gave me antibiotics, no tests. So a good chance that I probably have it in my system is probably 90%.
And part of the problem is that there's been two different camps in the medical community. You have the Infectious Disease Society of America, and then you have the International Lyme and Associated Diseases Society. Basically, when ticks pass on Lyme disease, there's also a chance that they could pass on any number of co-infections that comes with Lyme disease. So when you have symptoms that you usually would relate to Lyme disease, there's a whole slew of other symptoms that you might have relating to a different co-infection. And if you're not being treated for the co-infections as well as the Lyme disease, you're going to experience the chronic disease front.
So interestingly, one of the statistics I read was the fact that people that suffer, because obviously if you don't see it for a long time, it has a lot of other things that it brings on. And treating chronic Lyme disease is apparently very, very difficult. And what the interesting statistic that I saw is if you look at Lyme disease versus, let's say, multiple sclerosis, 37% of those with multiple sclerosis said that their quality of life was poor versus 72% with chronic Lyme disease, 62% with congestive heart failure. It was atop the list.
Well, part of it is because chronic Lyme disease isn't accepted by the medical community, and that goes back to the two different camps that we have. You have the IDSA who, up until very recently, their guidelines for diagnosing and treating Lyme disease was the only thing that the government typically accepted. But with more people coming down with Lyme disease, there's been a greater push for better treatment procedures, because usually it's only 2 weeks of antibiotics, possibly 4 weeks if you're lucky. And your symptoms can persist to months to years and continue to get worse and worse. So the IDSA has always been very much against that. And with the recent legislation, with their regulations being pushed out, there's a chance now that people that have Lyme disease can be treated long-term with IV antibiotics or hyperbaric chamber treatments. A lot of people are resorting right now to going out of the country because we don't have the procedures to treat late-stage Lyme disease.
No, the interesting part of the history of this, it comes from Lyme, Connecticut.
Yes.
This place called Old Lyme. I lived in Connecticut for a while. I'm from New England. This was back in the 70s. And the only reason they actually started to address this issue because two mothers got fed up with the establishment and decided to do something. And that's how a lot of this happened. And it's always true today. We can extrapolate. But there were two mothers of victims who went after this. And I saw that every year now there's well over 300,000 new cases every year. And it's been pretty much, and a lot of the courses up in this area, especially New England, but now there's a new whole strain of it they discovered at the Mayo Clinic.
There's actually 16 strains of Lyme disease and the Borrelia burgdorferi bacteria. But they
Say
found
that 3 times fast.
It's so hard. And then there's a secondary bacteria that is outside that strain or that family that they have.
The Mayo Clinic found, recently.
So what intrigued me also was the various symptoms or problems that you have with chronic Lyme disease. Fatigue, over 90% of
jawbone.
Chronic Lyme disease sufferers. Sleep impairment, again, above 80%. Joint pain, muscle aches, other pain, depression, cognitive impairment, neuropathy, headaches, and then, believe it or not, heart-related.
Yeah, in this area, there's actually something called the heart carditis, where basically it's inflammation of the tissue of
pericarditis.
the heart. That possibly is it.
Yes.
And they've had, it was 3 patients in this area that, in like the tri-state region, that just dropped dead. And it was between the ages of 28 and 36, and it was because their heart had so much Lyme bacteria in it that it just destroyed it from the inside out.
And it's amazing over the years, too, even just the prejudice against some of this, because like this woman that I knew, the boyfriend, well, he doesn't want to work, he doesn't want to do, because sometimes it's not that obvious, because the symptoms are such that it's really kind of difficult. So without advocates, like those mothers, who knows where we would be today, even with this. And even now, I don't know where we're going to be going with this, because the funding and research is really pretty low, considering.
The CDC gives Lyme research $23 million a year, and to put that in perspective, the Zika virus is getting potentially $1.5 billion a year to study and research. And again, it's the fastest growing epidemic in the United States.
It's under the radar.
It's insane.
So are there other things that are coming down the pike in terms of treatments, and I know you said the potential for people to get treated on a more regular basis, but is there anything else?
They've developed a 3rd test that just came out. The 2 tests that they use right now to diagnose Lyme disease test the antibodies in a person's system, and this new test would actually test for the pathogens of the bacteria itself.
Interesting.
So that would be a way to help get more people diagnosed in time.
Okay.
Yeah, because a lot of them apparently are misdiagnosed. The tests don't catch it.
They don't.
Quite a few. I was seeing up as high as 60%.
Right.
Which is not very reliable.
We'll leave with that. Last one. And next up, drug doses are up, and one drug is particularly to blame. Our panel will analyze.